as in the interest of time, just to say welcome everybody, and we're glad to have you. Today we have our second roundtable conversation from the University Advisory Council for what is still the CCGHR, soon to be the CAGH, and we're glad to host these conversations as a response to what were very genuine interest from our members about bringing people together in conversation about pressing issues, things that we're navigating as people connected to global health in whatever ways, through research, teaching, or service, and where there's Frederick. Welcome, Frederick. So in ways to navigate some of the challenges for research, teaching, or service that are arising out of the realities of the COVID-19 pandemic. And so today we're focused on thinking about how we can promote equity in global health teaching and learning, and especially to use the interruption from the pandemic to leverage new ways of thinking about how we support teaching and learning in global health, whether that support extends to health professional students, to graduate students, or in any of the various ways that we're supporting graduate students to navigate their learning in global health. So I'm pleased to welcome and introduce our panel today. We may end up with a smaller group, and so we can have some really good, rich conversation. We'll record this and make it available to our members after. I know from the last roundtable that we held, we heard that it was very useful. So we'll make sure that this is available as a teaching resource and as a tool for our members afterwards. So Thelma Abu is our intern with the University Advisory Council. She's working with Susan and I, and she will be hosting the conversation today. Thelma is a PhD candidate in the Department of Geography and Environmental Management at University of Waterloo, and her research focuses on quality healthcare services in sub-Saharan Africa. Welcome, Thelma. And I also I'll do introductions for our four speakers today as well. Some of them will be familiar to colleagues from CCGHR. So Shauna O'Hearn, wonderful to have you, Shauna. Shauna is the Director of Global Health in the Faculty of Medicine and a lecturer in the Department of Community Health and Epidemiology at Dalhousie. She's the past chair of the Canadian Society for International Health and has been part of our CCGHR University Advisory Council for some time now, and president-elect for Physiotherapy Education Accreditation Canada. Shauna spends her time creating inclusive space for health research and medical education, and with a particular interest in grounding that work in principles of equity. I'm also happy to, Shauna, do you want to just give a wave? You might have already given a wave. I'm trying to look at one screen, thanks. And then Frederick, welcome. Frederick Arma is a professor of environmental and sustainability science and director of research and director of the Directorate of Research, Innovation and Consultancy at University of Cape Coast in Ghana. He's an interdisciplinary scientist with a deep interest in the natural and human dimensions of environment and health, and a member of the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services. He also is a lead author on the United Nations Environment Program, Global Environment Outlook 6 report, and his professional interests include global environmental change, mitigation, adaptation, environmental policy, pollution and remediation, human health risk assessment, and socio-ecological systems. Welcome, Frederick. Erica Duriguero is the Director of Center of Global Health and the Director of the Collaborative Specialization in Global Health at University of Toronto. Erica is an Associate Professor in the Division of Social Behavioral Health Sciences and holds a cross appointment as Associate Professor in the Institute of Health Policy Management and Evaluation. Erica's research interests include population health intervention and implementation research science, health and health equity impacts, global agenda setting and policy, qualitative and mixed methods research, discourse analysis, knowledge utilization and exchange, and influencing public health decision-making at national and global levels. We're so glad to have you, Erica. Thank you. And Vic, who many of you know, is a physician educator, and he always often introduces himself as a failed retiree in international consultation and an international consultant, as well as an associate fellow at the Center of Global Studies at the University of Victoria. His esteemed career includes a range of academic leadership positions at McMaster University, the last of which he was the Director for Center of International Health. Vic has been a consultant and advisor to many international agencies, organizations, and institutions. He's currently a special advisor to the CCGHR, for which he was the founding national coordinator. Vic's interests include capacity development for health system reform, with a special interest in strengthening national health research systems, leadership development, and promoting a stronger role for Canada in investing and becoming involved in health research in lower middle income countries. Vic is a mentor to many, and I'm very glad to have you with us today too, Vic. All right, with that, those introductions, I'll turn it over to Thelma, who will be hosting this round of question and answers. And then as we get close to the end, we'll have an opportunity for some open dialogue as well with those of you who are joining us. So I'll turn it over to Thelma.
Thank you very much, Katrina, and thank you to our panelists for being here for this discussion. So I'll just delve right into our questions. And so we know the COVID pandemic interrupted various practices, modules, and approaches to teaching and learning in many ways. So my very first questions go to Shauna and Vic. I want to know from you, what is one COVID-related change to these practices and approaches that you think we will keep doing? So I will start with Shauna. Oh, sorry, Vic.
No, I was going to say the same. After you, Shauna.
Thank you. Thanks, Vic. And thank you, Katrina, for the introduction, and Thelma for the question, and most importantly, to all of you for taking time out to join us today. I know that everybody's schedules are busy, and so it's really important that you have joined us for this conversation, which is relevant to so many of us in the university environment. Thinking about teaching and learning in the pandemic and post-pandemic, we're still in, I think, the early stages of thinking about what are those lessons that we're going to keep moving forward. So I think today part of our job is to leave a few breadcrumbs for us to pick up at the end for some further conversation. One thing that, as I grapple with online learning and teaching, I think that it's really reinforced to me the importance of pedagogy, and the pedagogy focusing on adult education learning principles. And what I have seen over the past year is the importance of that relationship in teaching and learning with our students, and that students really are and should be active, engaged partners in the learning. We've talked about this for years, and I have noticed and engaged in that myself over the past year. And through the online methods, we really are able to think about what is that contract in the teaching and learning environment. The other piece to it is who is part of this. I think an example, a perfect example that we will continue is sessions like this. We can have all of you here for an hour and a half in a way that would have been very challenging to do a year and a half ago. So finding within the challenges of an online environment, the benefits of moving forward with our conversations, bringing our partners to the table, and making sure that students are active partners. All of those pieces, I think, are really important as we grapple with this teaching and learning in a pandemic and post-pandemic era. And we'll talk more specifically about it in a global health world in a moment, but I think those are a couple of things that have been important for me over the past year.
Thank you very much, Shauna. Vic?
Thank you. Something quite similar to what Shauna has just said, certainly more global involvement, both in as participants in an educational event, and I would say as educators and as well. So just a quick example. Katrina knows, we've just a couple of hours ago launched the second KT course. And we've had 66, I think, participants. And they just introduced themselves briefly in this session we just had. And it was just absolutely amazing the number of colleagues from all over the world that were participating. A couple of quick examples. A woman named Rima is in Palestine. She is concerned, she's a health professional. She's concerned about health system access to health care of refugees in her part of Palestine. And so she wants to learn how knowledge translation can help with that. We had a couple of people that are also participating in the CARTA program. This is the program where the coalition is a northern partner to strengthen graduate training, particularly doctor training in Africa. So to have a colleague sitting quietly in a darkened room in Malawi as part of this, all of which is to say, I think we're going to hang on to this kind of educational arrangement. Let me just add one other quick note, and that is, I think I've also seen that we're getting more creative with a variety of a mix of tools, video, Slack, websites, phone, etc., in a very creative way. So these are a couple of thoughts from me about what changes COVID has brought, we're experiencing with the COVID situation that I think we'll keep using. Thanks, Thelma. Yeah.
Thank you too, Vic. So the pandemic interruption also and perhaps reveals some things about learning environments that we took for granted. What stands out as some things of high value and what we should continue to cover. So what stands out as something of high value that we should continue to cultivate and work towards? So I'd like to hear your thoughts, Frederick.
Thank you very much, Thelma, for the opportunity. It's indeed a pleasure to be part of this roundtable. And I believe that we'll make some very insightful comments that will go into shaping our thoughts and then influencing some practical issues that we need to take into consideration as part of this discussion. And I want to say that the pre-COVID learning environments were designed to support active, engaged modes of learning. And many of these active modes of learning, the attributes thereof, can now pose danger as higher educational institutions strive to limit physical interactions. And I believe that the pandemic is increasingly questioning the necessity of physical presence by forcing many into virtual working arrangements. Faculty, researchers, staff are now more familiar and indeed more comfortable than ever hosting meetings and managing projects using video conference and digital collaboration tools. While the physical presence and investment will still provide advantages, I think that universities can now more confidently pursue initial arrangements and smaller partnerships that are developed either entirely online or in hybrid formats. Here I'm thinking about once in-person interactions are allowed. And there's, of course, deep uncertainty around what the learning environment will look like in a post-COVID world. What is certain is that COVID-19 has highlighted the need for new approaches, models, and solutions. This is something that we have to face head on. And I believe that universities must rethink their capabilities to provide blended in-person and remote learning experiences. This is very important. We will also have to reconfigure learning and common spaces using science-based and data-driven knowledge, which we have acquired over the years. This is the time to put it to good use. Planning paradigms of the past, which were for the most part driven by cost and efficient knowledge transfer, need to shift. We need to shift from that. And the universities will need to be more flexible and be able to adapt quickly to possible economic, climate, and health disruptions. These are all issues that I believe we have to take center stage as we move ahead. And then, of course, we also have to look at reinvented learning spaces, even deeper commitment to our well-being, because in this pandemic, era of the pandemic, it means that we need to look at well-being and health much more critically. We need to design for adaptability. In this particular context, we have to look at the fact that space no longer should be designed for permanence, but to change easily, expand, and contract. The spaces that we use as the medium to communicate the teaching and learning should be designed not for permanence, but to change easily, expand, and contract. We will also be requiring more solutions that are, let's say, those that relate to gesture or voice-activated commands, open doors, say whiteboard. These are technologies that are available. And indeed, in the context of Ghana, I say that many events and training courses that were planned to be held in person have been provided online, allowing participation from people who would originally will not be able to fund their travel or find space in their agendas. Here we see that although many of the programs and processes were able to be converted to a more digital format, this process or this transition was not a seamless transition for the most part, and it is something that requires attention. At the University of Cape Coast, I believe that bureaucracy proved a challenge in some cases, with official documentation still requiring physical signatures on paper, despite the availability of digital alternatives. So we have moved to the digital world where we are using digital authentication or even signatures, but still people were ensconced in the things of the past where they were failing to make the transition. And I believe that many services within universities remain the same, but of course, we'll also be looking at increase in virtual structure and components, and digitalization of lecture rooms will play a crucial role here. I would conclude this part by saying that international networking and connections provide a great opportunity. There will be less travel than in the past, but networks and online communities will play a significant role. We need to have a blended reality between the physical and virtual, and we need to embrace this as this evolution, in fact, increases choice for users, as well as potential research and innovation opportunities. Okay. So I believe that a dual streaming of both online and offline approaches should provide the best of both worlds. And despite the many questions still out there, I believe that innovation systems can and should view this crisis as a way to solve the challenge effectively and develop something new and better. Thank you.
Thank you very much, Frederick. That was that was informative. I want to know from you, Erica, what stands out for you and what should we continue to cultivate and work towards?
Yeah, so thanks very much, Salma, and to the organizers for including me on this panel. I look forward to the discussion as well. So I guess one of the ways I would answer this question would be by reflecting really on the global context. And I know we could have a whole session on this, but I think it goes without saying that COVID-19 intersects with several pre-existing crises, including racial and gender inequities, killing George Floyd and many people before him and unfortunately after, and the impact of COVID-19 on women's economic livelihood and also their productivity. I think that has, for me, really stood out in many ways. These are things we knew before, but certainly in a School of Public Health, we've always tried to be very intentional about addressing issues of inequities in our teaching. But the past year has really further underscored its importance in not just courses that are intended to address inequities, but in all courses. So just me personally, I think I've taken extra steps to connect with students to ensure they feel well supported, extra care in the virtual classroom, which can be actually more challenging to detect when students aren't engaging and why that is. It's more difficult, but to really take those extra steps to ensure the learning environment is welcoming, safe, and inclusive. And one of the ways I've tried to do that is to be intentional to create a space for reflection and acknowledgement of the many impacts COVID-19 is actually having, not just on students themselves, their families, the communities in which they identify with. And I think many of my colleagues have already made this point. I think on the other hand, the fact that we've had to pivot online very quickly has also come with many innovations, not just in terms of what content is delivered, but how it is delivered. We've been really rethinking, in some cases, the types of assignments, effective strategies for facilitating interactive discussions in the classroom. And I think many of those innovations, as others have already said, should be carried forward when we go back to more in-person learning. And so the question becomes, how do we integrate those multiple pedagogical formats for teaching when we do return? And how can we do that with the greatest benefit to our learners? Just one small example is that I reflected on in preparation for today is that in a Zoom environment, what I actually found was that some students who normally would be quite quiet in a classroom have actually used the chat function to share their ideas when they weren't feeling very comfortable to speak out. So I think there are things that actually have worked quite well to maximize engagement of the entire class. The use of online polls to sort of gauge the temperature and to add a bit of interaction in the classroom. And I think the other issue that hasn't been raised, which I imagine is affecting everyone, we have many international students who of course participate in our learning sessions. And in some cases, they've had additional challenges because they're not in the same time zone as our university is. And so making sure we really ensure that their learning is not compromised and that they're keeping up with the material in the same way, because some of them are making huge sacrifices by joining at really unfortunate times of the day or night in many cases. So I think really making ourselves accessible, it's just reinforce that relational dimension that comes with teaching in the classroom to ensure that we effectively support not just the intellectual well-being of our students, but their mental health and well-being. And I'll stop there.
Yeah, thank you very much, Erica. So we'll move on to our next round of questions. And in the next round of questions, I'd like to hear from you about how these interruptions invite us to reimagine our partnerships for supporting learning. So my very first question goes to Frederick. So Frederick, you navigate a lot of agreements with international universities. What has the pandemic interruptions sparked for you in Ghana in terms of how to navigate these agreements and partnerships generally?
Yes, thank you very much, Thelma, for this very important question. I'm most grateful. I will start with our mandate. The services that the Directorate of Research, Innovation and Consultancy offer include building and managing strategic relationships with external partners. And in this particular milieu, I'm referring to the private sector and our communities that we engage with. We are also into research development for larger, more complex and strategically significant research funding applications and fellowships. We are into developing strategic responses, changing research and partnership landscapes. We are also involved in ongoing support for interdisciplinary research, including oversight of the university's institutional research teams, the delivery and development of pump priming schemes, which aim to lead on to larger externally funded initiatives, and then of course, funder relationship management. So all of this fall within the constellation of our mandate. And I will say that in the COVID era, we are interested in agreements and partnerships that are geared towards improving knowledge management and transfer, links to academia and research institutes to improve indeed the scientific base on unique developmental challenges, issues of poverty, inequality, environment and health nexus issues, climate change issues. These are issues that are deep-seated issues and of immense developmental need to us. So we want to focus a lot of our partnerships on improving knowledge management and transfer on these disciplines. Then we are also interested in shortening the long research and innovation cycles. Hitherto, we see that it takes a very long time for the research and innovation that we churn out as part of our research to get to those who are supposed to benefit from it. We want to make sure that we have shortened this research innovation cycle to secure a faster deployment and entry into operation of sustainable life from our close collaboration with the academy, the private sector, civil society, communities, government, of course, what we refer to as the quadruple helix. We are also interested in agreements and partnerships that are geared towards addressing funding concentration and the need to ensure that there's enough transparency and openness to new partnerships, especially to research areas where allocation has been consistently low. These underserved research areas, for example, the role of indigenous knowledge in healthcare delivery in Ghana require funding attention, and we are very much interested in that. Then we are also interested in agreements and partnerships that are geared towards building capacity of our university to transition seamlessly from emphasis on face-to-face learning environments to the digital environment. And in this particular context, our university is interested in prioritizing hybrid or blended learning environment systems. Thank you.
Thank you very much, Frederick. So how do you think the pandemic interruption will inform the way you think about supporting Canadian students to engage in learning about global health? And Shauna, I would like to start with you on this question.
Thanks, Salma. I think I'm actually going to draw on a lot of the pieces that Erica just spoke about, actually, because it's not just about the pandemic interruption. I think we're at this a very interesting time in history. It's a record time in many ways, as Erica raised the Black Lives Matter movement, the Me Too movement, our Truth and Reconciliation, all of these structural inequities they are highlighting our structural inequities, which are also within our global health work. There's a strong movement at the moment that has been written about, talked about around decolonizing of global health. And I think that piece has been really highlighted in the past year because of the inequities that the pandemic and all of these global social movements have raised. So I think, and Erica, you really raised it very well of how I would support, or how we support students, not just Canadian students, but students studying at Canadian universities. So our international students as well within our post-secondary institutions. So that need for support, need for reflection, need to make that connection with students is so important. In addition, some of the work that we've been doing at in the East, which I'm sure is in many other institutions as well, is what are the supports that are around our students? So building mentorship programs, and those now in our virtual environment may be one-on-one, or some of them have been group mentorship programs and peer on which is important. The other piece that's been really an important piece in building and understanding the needs of support for our students is around faculty development. And so a lot over the past year has been a lot of training around and supports for our own faculty who have these questions, who are working with students and struggling. So there is the piece, and I know your question, Thelma, was about what supports do we provide for our students, but one of those supports I feel is really important are how are we supporting our faculty who are also in this learning journey. Many of our faculty have never thought about global health. It was something that took place over in that office over there. Global health is now something that is, as we've all talked about in the coalition, and I know in the UAC we've talked about this so much, global health is everywhere. It's not just something that happens over there. The pandemic and all these social movements have brought people to our doors. in a very different conversation than they would have been 2 years ago. So there has been, for me, a conversation with students, but in many ways, a conversation with faculty, which has been an exciting opportunity to have new partners in our teaching and learning environments. So I think I'll leave it at that for now and hand it over to Erica.
Okay, thank you.
Yeah, thanks, Shauna. Those were great points. Yeah, and I actually, maybe I'll just pick up on this notion of global health. You know, we're among the people who always knew it was important, but prior to the pandemic, there were many, you know, in our own institutions who had not even bought into the notion that global forces impact on our health here at home. And I know that may still sound surprising in 2021, but I think that's a fair statement, but also how we're interconnected as countries and the implications for health equity and also the health of our planet. And of course, the pandemic has changed this, but it's also raised many issues that were already present, but in the context of the pandemic, so protection of borders, which I think has really been very challenging for our diaspora. So if we take the example of what's happening in India right now and access to vaccines to contain the pandemic there, vaccine nationalism that's really reinforced that approach to my country first approach to health rather than thinking about health in a globalized world and to think about it in terms of global solidarity. And we all know this intuitively, but those who represent us, leading governments, et cetera, are often torn between protecting the health of their citizens first and versus taking a more global solidarity approach, because we all know that we're as strong as our weakest link. And certainly the pandemic has taught us that. So I think the key will be to sustain this kind of global and critical orientation to global health going forward and to continue to bring these perspectives into how we educate and mentor and support our students. And, you know, in the interest of time, I won't go into all the examples that sort of come to mind, but happy to share some in the Q&A period around some of the courses that we've innovated with just to take that challenge up. And then the only other thing I would add, because the question really was speaking about how to best support Canadian students to engage in learning, you know, they can only learn if their mental health and well-being is also attended to. So as a school, we've taken extra steps to offer access to mental health and well-being services. Many of these students who had started graduate school last year during the pandemic didn't even know the students in their cohort, and that sense of social support that you get from the students in your own cohort, that cohesion, it was much more difficult to build compared to, you know, students who'd be in their second year of graduate training. And so we've tried to, you know, create more opportunities for some of these other wraparound services and worked very closely with our Public Health Student Association. And then I guess the other thing I'll end with that I've noticed that I think has a benefit to students, but is also about the environment that we are trying to create for students. And that also speaks to what Shauna already raised, and that's services directed at faculty and also staff. And so we've really seen an increase in the availability and also uptake of anti-racism, anti-bias training, not just for faculty and staff and students as well. So as sort of ways in which to support global health, but also learning. And I'll stop.
Okay, thank you very much, Erica. And my next question goes to Vic. What do you think all these shifts and changes offer to us in thinking about meaningful partnerships and their role in learning?
Thank you. Another tidy little question that's been put to us. First, to recognize the good points, very good points from Shauna and Erica. Please take them to heart. I won't repeat them, but they're just very practical. Let me just add one other thought, and that is, I think we're seeing more through the partnerships, much more what I would call south-north learning, particularly on the part of colleagues in the so-called northern part of the world. Again, an example that occurred that illustrates this for me was in the knowledge translation course I mentioned earlier. Last year, I was with a group that had several Africans in it, both from Ghana and from Zambia. Happens that Thelma was one of these. And the question was, what's the strategy for managing COVID in rural Africa? And be interested in Frederick's comment if that comes up. And in particular, the colleagues from Zambia and Ghana said, we need to perhaps change from thinking about individuals to villages as entities. Villages in rural Africa are quite self-contained. They have the social, economic issues that are traditional in these villages. And for example, something that needs to be thought about is if a public health nurse goes to a given village in rural Zambia once a month to do her work with women and children, we'd better be very sure that she isn't carrying or he isn't carrying the virus with them to get something going in that village. It sounds simple, but to me it was quite an aha. I just hadn't thought about that. The role of thinking of villages in rural Africa and how important a concept that was. So to summarize, I think we're in a good place to learn much more from south to north, north to south than we were before. And for me, that's been quite a strong experience. Thanks, Thelma.
Thank you, Vic. And right now, let's talk more about what this pandemic reveals for us about integrating equity considerations into teaching and learning about global health. And Frederick, I want to know from you, when Canadian universities want to partner with you at the University of Cape Coast in Ghana, what do you want them to be thinking about as good global citizens and equity promoters?
Thank you very much, Thelma. This is a very important question, which is dear to my heart, because in the past, most of our partnerships were lopsided. We saw a lot of hierarchies. It was not what we would consider to be a typical partnership. It was something else, but not partnerships. So lately, we want our potential partners to reflect on the following. We want them to know that transfer of technology and knowledge in one direction is no longer acceptable of partnerships between researchers from the global south and north. Partnerships in research, collaboration on an equal footing. This is very, very critical. We are now advocating for equitable research that focuses on themes of deep interest to our university to achieve optimal ownership of the research programs. And I believe that universities in the global south will need to contribute to joint research projects in order to negotiate project contracts, because we need to build capacity even in that particular domain, negotiate project contracts for equitable sharing of benefits of collaborative research as part of the North-South partnership. We want our North-South partnerships that are transparent, based on mutual respect, and deliver on mutual benefits. In this particular context, we want our potential partners to be thinking about fairness, respect, care, honesty, and all of which underpin responsible research and innovation. we think that power asymmetries in the context of knowledge production and translation is something that we need to also take a critical look at. And in this particular context, we are saying that we should focus, or we should zoom in on questions that include, for instance, who formulates the research questions for indigenous communities and minorities in the Global South, and by extension, who formulates the research questions for the Global South partner. These are critical questions that we need to come to grips with. Who frames the issues and developmental problems of these constituents? And do this emerge on the political agenda at the local, national, and regional, global, national, subnational, regional levels? We need to really look at the framing of the issues and the developmental problems that pertain to the Global South, and how this would emerge on the political agenda. Which ones enter the political agenda and which ones fizzle out? Which ones never get the opportunity to get to the political agenda, irrespective of the fact that they are very important. This is also dear to our hearts. And then we are also interested in posing the question, who designs and proposes the analytical lens we use in our research to understand the research problem and context, especially from the Global South perspective. This is also very, very important, because the analytical lens that we use has implications on the findings, has implications on the discussion, has implications on the conclusions, and even the practical uses to which the research can be put. This is very important. And then we also look at what role do our local communities play in the processes and outcomes of knowledge generation. So here we are thinking about co-development of questions, co-production of knowledge, co-formulation of local sustainable solutions. And this is, of course, consistent with the axiom that you think globally, but you act locally. In essence, when undertaking research and innovation activities in Ghana, we and our partners must jointly recognize and address the possible impact of contextual, societal, and cultural differences on the ethical conduct of research and innovation activities. This is what I think we need to be reflecting on. Thank you, Thelma.
Thank you too, Frederick. And so how do you think practical experiences in global health are transforming, and what about it is exciting for equity? Shauna, this is a question for you.
Thanks, Salma. I'm just sort of absorbing all the things that Frederick just was sharing with us. I think it'll be nice to unpack that in our discussions. So I think in the global health education community has changed even pre-pandemic. So my world is within the clinical training, within the training of our medical students and nursing students and all of the health professions. At one point, I'll give an example, there were 50% of our graduating class who would do an international elective in their training. So that's a lot of students, not all going to low and middle income countries, but majority of them. And I would say about 4 years ago, those numbers were down to about 10% of a graduating class. And then the year before the pandemic, it was 1%. There are lots of reasons for that. Some of them are about cost. Some of them are about their future career paths. But one of the big pieces, or two of the big pieces that came up, was what impact as a student do I have on a healthcare system, institution that I know nothing about? And so that first do no harm conversation became quite predominant within the health profession community, and really had students thinking about what is global health? What do I want to be learning from global health? And it came to questions around, as we've talked about, around determinants of health, around advocacy, around community health. And students started thinking, do I need to travel to outside of my own community. And so what I've seen, and particularly during the pandemic, that has become quite strong, is students engaging within their own community to understand health inequity, to understand inequity itself, and then health inequity, and to work with local community organizations. And I think, Frederick, your questions were so pivotal, not just of who's asking in a country, but within a community. And that's what I see the students starting to engage in partnerships with community organizations that they didn't even know were within their community. And that is also transforming within our curriculum. So we have put in place frameworks for reflection, frameworks to help students understand what does it mean to engage with communities. What does that look like? What supports do I need? That has been a huge and an exciting, I think, opportunity both for community to engage with the university, as well as for students to engage with community. And then for us as a global health community to broaden our conversation to local global health, and then starting to make those connections more broadly, globally. So that's one example that I see.
Okay, thank you very much, Shauna. So I'll move to Erica. How do you think content in global health courses and graduate research is transforming? And what about that is exciting for equity?
Well, you know, I guess we're quite aligned in our perspectives. I don't know what that tells everyone, but maybe I'll just reiterate a few points I already made, because I think I made this point at the outset, but I think there's now much more of a major focus on equity in all courses, including global health courses. Also, a greater attention to anti-oppression and intersectional pedagogical approaches, which again speak to not just the content, but the how the courses are delivered. And that demand has also come from our students in courses that I would say were blind to these issues. And I think that's a good thing, because you can't continue to just rely on global health courses or courses that are called health equity or courses that are called social determinants of health to do the job. Because, you know, courses that teach you how to do sound epidemiological studies also need to be using examples that are sensitive to these issues. And I think there's been a raised consciousness of that. The second, I think, which is exciting, is more and more global classroom models are being experimented with, which, you know, I think speak to some of the excellent points that Frederick made about co-designing those classrooms with partners in low and middle income countries, so that the learners from those countries and learners from Canada co-learn together. And an example of that actually was happening before the pandemic was a course on climate change, which again lends itself, I think, beautifully. And it involved learners in Kenya and at the University of Toronto. Another example, which I think speaks to what Shauna was just raising about raised consciousness about the inequities that actually continue to be present in our own neighborhoods and our own backyards. And so I think we've seen a greater and more explicit attention and research into how these conditions of social and economic marginalization impact people's experiences, and how that's being translated into how we think about COVID-19 and the outreach. So some of my colleagues have been very active in efforts to rebuild trust with African Canadians, the diaspora from many African countries that live in Toronto and the Caribbean, to rebuild trust to help with the vaccine rollout. So I think that's an example of where faculty and also students have been very engaged. The example around advocacy on sick days, you know, I think many students have actually been very active in decent work campaigns, fairness of wages, again, it builds on activity that occurred before the pandemic that became a huge pivotal point for those of us in Ontario when recent measures that were announced by the government of Ontario were incredibly blind to the fact that how can someone isolate for 10 days when they don't even have sick days and entire families are contracting COVID. And I guess finally, I'll just conclude with a point around increase in conversations and deep reflection on what it means to decolonize global health research and pedagogy. And I think institutions in the global north, like the one I sit in, have a lot more work to do. We are engaging regularly in these conversations with colleagues and students, involving scholars and leaders in the global south, but we're only beginning on that journey. So I think that is, speaks to your central point of your question around equity, but there's more work to be done.
Thank you very much, Erica. So Vic, would you like to share your thoughts on the impacts of COVID-19 and issues of equity in teaching and learning, global health?
Thank you. Time's moving on. Let me just mention two things, I think. Well, I should first of all thank both Shauna and Erica and Frederick for terrific insights. When Frederick is speaking, I was reminded that some years ago in the coalition, we created a tool called the Partnership Assessment Tool, still available on the website for people to have a good look at. And many of the issues, Frederick, that you brought up, we've tried to capture in that tool. So encourage people to have a look at it. One thing that probably hasn't been mentioned so far is, and colleagues like Craig and Susan, I hope will comment on it since they brought this to mind, is that universities tend to be risk averse, is a term that my friend Craig used. And they're finding that some of the limits of continuing with partnership research in particular are really quite difficult, just because universities have special rules that prevent creativity and continuity. Perhaps our colleagues will comment on that. Let me just add one other thing. The discussion about involvement in the early stages of a research project in the area of problem framing, mentioned by Frederick, and as well as team building at the early stage before sailing into the actual knowledge production itself, reminded me of a paradigm that I've used on and off over the years from the literature of sustainability, where a three-phase framework was brought forward. The first involving problem framing and team building itself as fundamental to getting the questions right. Second, to facilitate co-creation of that solution-oriented knowledge to be transferred. And the third phase, of course, is to reintegrate and translate and apply the created knowledge from these partnership groups. So it just reinforced that for me. So these are a couple of additional comments to the very good comments from my colleagues. Thanks, Thelma.
Thanks, Vic. So we've come to our last round of questions, and I have one question for all of us, for all the panelists. So first of all of you share an interest, I'll say all of us, because I began teaching this term, all of us share an interest in supporting learning and doing so in ways that honor equity. How can we learn together and help each other? What can we do to be supportive and responsive? So I would like to start with Erica.
Yeah, thanks. Yeah, I'm going to try to be brief because I don't want to repeat what's already been said, because I think this question kind of builds on our previous reflections. But I'm going to, and I think this is where the coalition has done an excellent job, one of many areas, and an idea to maybe move forward in the new organization is that as institutions that, we have mandates, we have students to serve, we have interests to serve, just we have to name them. And I actually think we need greater mechanisms for sharing of promising practices across institutions. And part of that, it needs to be fueled by an increased emphasis on evaluating these novel approaches. So what I mean by that is pedagogical approaches to global health, education and research. And this is important scholarship that I think we need to value and also build on. And I know some of the efforts that the coalition has already undertaken, for example, the excellent work that was done on the coalition principles and getting a better handle on how they're actually getting integrated in different educational courses in CCGHR peer review, et cetera, I think is a great place to start and a good model. And second, I think it picks up on some of Frederick's points around, how we collaborate with institutions in other countries and learning collectively about the impact of those partnerships. Are they really coming from a place of mutual benefit, co-construction, co-development and framing of the problem? And that also leads me to how we can learn from other pedagogical approaches that do not subscribe to sort of what I would call a traditional Western model of education. And so critical reflections from many different cultures, how we can learn from our Indigenous peoples, and examples of learning on the land and how that differs from more traditional in-classroom learning. And then finally, really greater humility, empathy, and more listening to the diverse perspectives and lived experiences that really enrich our classrooms. And if we're intentional about that, we need to be creating spaces for these diverse perspectives to emerge so that it enriches the classroom. So I'll stop on that point.
Okay, thank you. So Vic, would you like to share your thoughts?
Thank you. Let me just add the thought that we have a great opportunity when colleagues from, I guess we'll use the term, the global South, come and participate in our educational programs, doing PhDs, postdocs, and the like. I think that we could pay more attention to not just the content of whatever the PhD thesis is going to be, but to help prepare them for leadership when they return to their own universities, into their own countries, with specific experience in leadership development, faculty development, and things of that kind. I would just add that to the colleagues that are directly responsible for the PhD programs, in addition to the topic of the thesis itself, to add these additional skills that I think will help strengthen the partnerships both ways. Thanks.
Thank you. Frederick?
Thank you very much, Thelma, for this very interesting and loaded question. I'm most grateful. I must say that learning is based on what we don't know. And as academics, we must be humble enough to admit what we don't know and be open to learning for our mutual benefit. In the era of COVID, there are several unknowns. And these unknowns, for me, provide a platform for us to learn, because there will be opportunity for us to jointly explore these issues. For instance, we don't know when it comes to the fact that will reductions in research support services negatively impact some universities' ability to enable certain forms of research or successfully compete for certain forms of research funding? This is something we don't know. We also don't know whether research collaboration will continue at this level and in any additional fields of study. In what ways this global pandemic can be a catalyst that ends up changing research culture. We have no clue. And then we also do not know whether the suspension of in-person research work, either in the lab or even through in-person conferences, created new levels and mechanisms for communication and cooperation that might be lasting. We don't know. We also don't know what kinds of virtual events will develop a lasting presence in scientific communications. Would there be a return to large-scale in-person conferences? We have no clue. Will we see an increase, even in the long term, in scholars sharing and using data from others, given individual limitations in data collection in 2021 and beyond? These are questions that we have to grapple with, and they provide opportunities for learning because they are unknowns. We also don't know how much of a setback the pandemic will create for women in scientific research. How will individual universities and the broader scientific community combat the disproportionate effect on female scientists and researchers? We don't know. How long will it take women to regain the standing that they had prior to the pandemic? We don't know. So all of these unknowns, to me, provide a veritable platform for learning and for exploring this jointly. And here we have to tap into our respective strengths. Every university has a niche that characteristically define its strength as academic community, and I'm sure we can tap into that for our mutual benefit. To end, I would say that there's immense opportunity to learn by exploring some of these issues that are flagged and tapping into the core research competencies of specific partners. We need to empathize with less endowed and disadvantaged partners and communities in order to elicit a response that fosters long-standing cooperation. And in this particular context, I dare say that co-production of knowledge and knowledge translation offer very potent platforms for mutual learning among the partners. Thank you.
Thank you, Frederick. Shauna, you have the last word.
Wow. So the question is about how can we be supportive and responsive? And I think this is a perfect example. This is one of many strengths of the coalition and of the global health community. This is what we do. We listen to each other, we challenge each other, we support each other, and we just don't take the answer as simple as it is. So I had all kinds of things to say, but they were all kind of embedded in the words of Erica, Vic, and Frederick. Making sure that the right people are at the table and that we're listening is important. The one piece that I might add to our conversation that we haven't talked about is how do we ensure that we're appropriately compensating everyone at the table. In our global health community, and for those of us who are asked to sit at various tables, that piece around compensation doesn't often come up. And particularly when we look at, and Erica raised some of the work that's taking place around anti-racism and anti-oppression, there is a huge burden of work on a small group of people with no compensation, no conversation of it. And I think that we do need to bring that really uncomfortable piece into our dialogue. And it is uncomfortable for us because this is work we are passionate about. But we also do need to think about how everybody is supported. And as Vic said, how do we support people into their career trajectory? And that's part of compensation isn't always about money. Compensation is also about what's on your CV to help you to your next step in your career. And all those pieces, I think we're very good at the coalition of having those conversations. We just need to make sure we're going into the places we may have forgotten over the years. I'm going to leave it there.
Okay, thank you very much, Shauna. So our panelists have raised some very important and interesting points, and I see comments and questions are coming up in the chat. So at this point, I'll hand you over to Susan to handle the Q&A. Thank you.
Thanks so much, Thelma and everyone. What an amazing conversation. There are some amazing comments in the chat. I encourage you to go, excuse me, in there and look at that. I'm going to steal Chair's prerogative and say one of the issues that you raised, Vic, which I think Craig and I feel very strongly about, is the barriers that our universities put into place in the context of being able to bring international graduate students into our labs. And so I was just sharing with my financial person this morning, we were talking about accounts, and I said, the only thing that keeps me up at night is how am I going to pay for these international graduate students who deserve such an opportunity? And if I don't provide it, where are they going to find it from? And so helping our universities, as Shauna said, coming together as the UAC and talking to our universities about the importance of the fact that internationalization is not simply recruiting undergraduate students from families in other countries that have deep pockets. So I want to also come back to this issue of technology. I very much agree with Erica. The piece I really want to hold on to is when I do Zoom calls in large classes of 50 students and more, and the chat is just alive with conversation, which we don't see when we're in a classroom. So I really want to hang on to that. But we had a couple of questions about the equity of technology. You know, in many parts of the world where bandwidth is not great, or power outages are a regular thing, or internet is not great. And we have struggled with that in our teaching. And you probably saw some really bad press being given to a faculty member at a university, which is not represented on this call, because the student was actually in a refugee camp and couldn't get access to internet to participate in the class. And the instructor did not treat that situation very well. So how do we maintain equity in global health teaching when we are prisoners of technology? Anyone on the panel is welcome to jump in.
I don't know. It's a really important question, Susan, and I don't know that there's an easy answer to it, because we see that you shared sort of the extreme scenario, which is a terrible situation. We see it in Canada too. The bandwidth situation is not great for many of our students, even in rural communities, and not just rural communities, but particularly. But it is something that we do need to grapple with as institutions, and particularly as we move forward. And I think, Frederick, you talked about hybrid models of online and in person when those days come. It is going to be one of the biggest pieces that we need to struggle with and to work through. And I don't think at this point there are no easy answers, but it is one that we have to be mindful of as we put together our curriculum, our courses, and to my point earlier of students being part of the learning contract, how do they have a voice in the development of that curriculum as well?
Anybody else? Yeah, please.
Am I on? Okay.
Yeah.
I'll jump in just with the comment of my answer was going to be cell phones.
Yeah.
A number of African colleagues have taught me when I'm there about how clever they are at using cell phones and WhatsApp and things of that kind, much better than I was used to. Maybe Frederick could comment on that. Anyhow, that's my little piece to throw into the conversation.
Yeah, thank you very much. I want to comment on this. This is true. I think this is one of the areas that we've made a quantum jump when it comes to improvement in access to mobile technologies, the cell phone is one that stands out. So in that particular context, I can say that we have leapfrogged the process or the technological gap. And this is insightful. So we have to look at what lessons this can teach us and how we can appropriate those lessons for other sectors and make sure that we are tapping into that and expanding the scope of the success. But we must also understand that technology, no matter how useful it is not benign. So there are always issues about inequalities in access, and all of those things that must also feature prominently in the way we tailor the programs that we intend to roll out as part of our curriculum. This is what I'll say.
Yeah, very, very true. Go ahead, Erica.
You know, I was just going to say that actually the UN Assembly, I was just looking it up because I couldn't remember the date, actually declared access to the internet a human right. And I think that's, so is that just lip service? And COVID-19 is just further underscored that people don't have, they have differential access. And this is, you know, not just in other countries and rural and remote communities, and that therefore interferes with their equal opportunity to participate in education, along with others who might have a more secure connection. And so I think, you know, we have to think of new ways to compensate, because internet access is not cheap. And, you know, not to get into Bill C-10 right now, but I think we are among the highest payers of internet fees and cell phone fees in the world. So that's just Canada. I'm not going to speak for other countries. And so if you add that on top to students who are coming here and having to access it, you know, there are fundamental barriers right there. So that's all.
Absolutely. And, you know, I'm glad that Shauna also brought in Canada because, you know, when Trudeau was running for Prime Minister, he made internet access a, you know, part of his political platform in Canada. And I thought, well, that's just silly. What is that all about? And it just so happened that a couple of summers ago, my daughter, who was at, you know, just finishing her degree, got one of these student passes to ride via rail, the train, all across Canada, right? And so very family members and friends joined her on different legs of that journey. I was the lucky one who got to meet her in Saskatoon. We holidayed in Saskatoon and we took the train from Saskatoon to Toronto, 52 hours sitting up on a train. And I would say for 90% of that journey, we had no cell phone access. We were traveling through parts of Canada. We're not talking about internet. We're talking about basic cell phone access, no access. So there is a big part of our country where students are really struggling, you know, and it's almost as, you know, like the Laurentian University situation where it breaks my heart that not only are my colleagues losing jobs, but that, you know, Sudbury is losing an economic activity and local students are losing out on access to a local northern educational facility. It just breaks my heart. And I want to come back to that well-being piece. Frederick, you raised the well-being piece first, and Erica, you talked about the well-being of students, and Shauna, you talked about the well-being of faculty, which I really appreciated. I want to come back to that because I would say that that was one of the most difficult aspects for me during the pandemic. I thrive on being in the classroom with students, and I really missed that. I didn't struggle too much pivoting to online because I live at the University of Waterloo. This is what we do, right? So that wasn't too much of a challenge. What was a big challenge for me was the expectation that I was meant to pivot. I was meant to meet the learning objectives of these students and also look after their well-being while looking after my well-being. And I'm really one of the fortunate ones. I don't have small children at home. I wasn't homeschooling. You know, we both still have jobs, all that kind of stuff. But it was a big stress on me, a big expectation on me. And I have no training in how to look after the well-being of students. I did what I felt that I could, but halfway through the term I sent emails to probably 15% of the students who I saw in my online system were not submitting work, were not going online and saying, I'm here, what can I do? How can I help? No one responded. But I also just really feel like I don't know what I would do. I don't know what to look for. I wasn't trained in that area, and that just added more stress to my life. And so maybe that was my university that let me down in that area. So I just want to come back to this issue of well-being, and what do we think we might have learned from that we could carry forward.
Yeah, if I may come in briefly.
Mm-hmm.
Yes, so I mean the concept of well-being is complex, and we know that it is not unidimensional. So you were thinking about well-being of faculty, you were thinking of well-being of students, you were thinking about well-being of communities that we engage with. But then perhaps you may have left out your own well-being, because sometimes we derive some benefits, some collateral benefits from our engagement with students that we seldom characterize. So it is difficult to know what you are missing out on until that platform is no longer there. And then you begin to reflect on the fact that I'm missing something which is an intrinsic part of my everyday life, and it is impacting my well-being negatively. So this is what I would want to say.
Yeah, no, it's very true for me. And my hope is that, you know, when I go back to the university in person someday, that students are really happy about coming to class because I miss them. Shauna, did you want to jump in there?
I just want to say the piece I think the pandemic raised was this issue of well-being, and particularly for students, maybe for faculty and staff, was before the pandemic as well. It raised it. And students were saying that they had concerns, that they were worried. I heard graduate students saying it before, but there wasn't a platform, and there wasn't maybe a safety net to be able to have the conversation wider. So as difficult as a time as it has been, I think it's created an opportunity for us to think about a student, to think about our community, our faculty community, our staff community as a whole, not just as a learning body or a teaching body, but that well-being. And that part was, as you say, was not part of the conversation before, but now with COVID, we're able to have that conversation and start to think about strategies, start to think about training and supports that are in place or need to be put in place. So it is, for me, what I have seen, an unfortunate, a fortunate silver lining to an unfortunate silver lining that should never have been there, right?
Mm-hmm. Yeah. Yeah, I mean, I definitely concur with that. We know that the pandemic has shone a spotlight on existing inequalities, and that we very, very much hope, as somebody put in the chat, that we don't bounce back, that we bounce forward. And I may be putting words in Jacques' mouth, but I think that was the intent of his comment. And to maintain the pieces that really worked well, and maybe put aside the pieces that didn't work so well. I will say, for example, that I co-taught a graduate course, no names, but the instructor that I worked with was so enamored of technology that we used our online content management system, which is called Learn, which is a desire to learn product, of course, invented at the University of Waterloo. We used Slack, we used Google Slides, and we used something else. We used 4 different technologies, and I think the students were overwhelmed. I was overwhelmed. But I was also able to have a class where I brought in international speakers to talk about their experiences in different parts of the world. That part I never want to lose. I actually was part of 2 middle school classrooms this year in my region, who reached me and said, hey, these students are doing up on safe water. Would you come and talk to them? And I said, absolutely, I would do that anyway. But because of the pandemic, this became an option for them, or they saw it as an option. And that was great. Not only is it great to talk to young people, but it's a recruitment tool, right? Come to the University of Waterloo, or come to the University of Toronto, or come to Dalhousie when you're done with your schooling. So I'm going to recognize our time. I'm going to wrap up now. I really, really want to thank everyone on this call, particularly Frederick, for coming in from so far away. You get the prize for being so far away from where we currently are in Canada. And we hope that you will continue your involvement with the Canadian Coalition for Global Health Research, soon to be the Canadian Alliance for Global Health, because it was great to have you on this call with us. I know that this is being recorded. We will probably stop recording in a moment or so, and it will be posted on a YouTube channel. And everyone who registered for the talk today will be given a link to that. So please use it in teaching, use it, to talk to your chairs or your deans, to help them hear that, we need to remove barriers for international students. We need to make sure that when we do global health research, that it's done in a way where we celebrate meaningful partnerships and shared benefits. So thanks very much to everyone. Really appreciate it. Hang in there. There's a light at the end of the tunnel, and we'll see you at the next roundtable. Thank you.